Testing. Hello, hello. And we go on live here. Good evening. Hello, everyone. Yes, and this is your dentist talk. This blog is designed for people who really want to learn about their teeth, how to save their teeth, how to keep their smile bright. And I want to make myself available. And the goal is to get connect with my patient and with the community and try to help the best I could regarding your dental smile. So I know it's been a while since I've been back on. I'm hoping everyone is okay. And I know I dropped my live blogs for a while because uh, my schedule. So there's a lot of things happen. It's all good things, and just being busy in life. And during this time, uh, I got to accomplish many things, but I felt I've been missing my live blogs and and I got a lot of requests, and I heard especially my patients telling me that those video were very helpful for them. So that's definitely encouraged me to go back and um, and get motivated and reach out. And honestly, I feel like myself, I need to connect with the community and be part of um, a good plan or a motivational plan for my patients and for the community to take care of their teeth, to give them hope, to give them some answer, and hopefully some solution, and encourage them to get to their dentist. So again, this is Dr. Ferris Arazik, and welcome to your dentist talks. So this is very basic. You can ask question, you can email us those question, and I will try in my next blog to answer those question. I'm gonna keep this live video saved because many times I go live in a time where it's convenient and working for me, and I want to make sure that time also will be convenient. So some of the thoughts came to my mind, especially today because I met a couple of new patients, and I want to talk about my first patients, and she has 3 implant placed a while ago, and now she need one more to be placed, and she came to me, and her goal to get this implant which I think that's wonderful. And but she want to have the implant place and focusing on the implant, which is something I respect. The only challenge I had after I engaged sincerely with this patient, that sh after the examination and going through a co-discovery, whereas me and her, we talk about all of her needs, her desires, and her actual oral health right now, the foundation that we're gonna build on. There is many issue, fundamental issue about the dental care that's not available for me to move forward with the dental treatment. And I have to go to where's to engage further and to know her concern further. And the more I hear her, I felt like we need to slow down. And I don't think she understand what's it's gonna take to get that implant placed and restored. My patient don't want implant. My patient want a tooth. They want the function of the tooth through the dental implant. So after engaging with the conversation, there's a basic and a minimum requirement, a prerequisite, if you will, for her to get implants safely and successfully. So, and one of those need was to get a good dental cleaning. And that's not um, to discount her main concern, because that's always the priority, but because of also other requirement, other hidden requirement that she didn't know about, that the longevity of this implant, the success of this implant, it's directly related to the oral health. So, and I had to say no to moving forward. And I asked her, and I wish to work with her on allowing her to get dental treatment done uh, through her dentist and come back to me for the referral surgery in the implant placement. So it's very important to get my patients healthy and at minimum with healthy surgical field before I go and insert implant in my patient's mouth. I'm talking definitely about dental implants here. Um, so if your main concern to get dental implant, and even though that's the specialty and that the focus of my practice, and but I have to look at the big pictures. I want my patient to look at the big pictures. I want them to be healthy, and I want the success of the implant to be uh, on the high end. I want to make sure this I can get this implant and with the minimum risk that's I am willing to take, and of course my patient want to take. So getting healthy is very important, and that's exactly what I want for my patient. I want to get them the implant. I want to get them the smile. I want to make whole again, but we have to have a healthy mouth to move forward. Getting done before they come back to me as a specialist in this dental implant field and move forward with the dental treatment. Another situation, another patient that I had the pleasure to meet today drove to us from a long distance. And uh, in my first thought that my patient has a multiple fracture of a hybrid prosthesis, basically a full bridge over 6 implant he had 4 years ago. So multiple chipping of the dentures on the top of the implant over the years, and finally my patients lost trust in the dentist um, who done the work. So they they come to me, or he came to me, driving 1 hours away. He lived 1 hours away, so he drove a whole hours to to take a second opinion, to know what's going on, um, to be able to be helped in making the next decision, because he's been quoted for a new a hybrid prosthesis, a new denture over implant, um, and he'd been quoted for 2,500 for a new one from the same dentist who placed the implant, done the work over the years, and when my patients come to me from a different dentist for a second opinion, and it sounds like this patient heard a lot of good things about us here in the practice at Icon Dental Implant Sedation um, Centers, sedation and implant centers, and he the what's kind of after I engaged with the conversation with this patient, I asked him specifically what's make him choose us, driving 1 hours away, and we are in a small town. We have a much bigger town around us. Too many dentists, and I'm sincerely interested in the reason, because uh, I want to learn about that reason, and I want to maybe see if I can make that reasons be a that's good word, or that reason to be uh, uh, put emphasis on, and make it work better, because I want to see more patients. I want to be able to help more people. So, and the reason why he wanted, uh, and he heard a good word about the practice regarding being transparent, because he is at a point where he don't feel like he know what's going on, because of multiple failures over the years for this hybrid procedures, or this basically a full dentures over implant, six implant, and to be specific, of the upper arch. So my patients here want to know more about the materials, and he want to know more about the alternative. He want to know about choices. He basically want more information to be able to make informed decision about what he need to do. Should he just kind of replace the hybrid prosthesis? Should it be repaired? And what the situation is. So, of course, when I get a patient from a second opinions, and there's a unfortunate outcome, first I want to be in the patient shoes, and also I want to be a fair, uh, present a fair presentation of the person who is not present, which is the other dental office who provide the service, because I want to make peace, and I want to be able always to allow that communication, and in a good way for the patient, and encourage the patient to reach out again. And since this patient specifically want more information, not necessary for me to complete the work or do the repair or do the new procedures, his goal was to get more information. And the first things, and when I engage with this patient specifically, which is wonderful, really great, really awesome person, and, and I and I enjoy a full 45-minute in conversation with this patient. And one of the things when I start to engage, and in when he started sharing his concern with me, and I had to kind of stop and ask him, did you share this concern with the dentist who made the prosthesis? And the answer was, for multiple concern of his, that he never get to see the dentist again. He's seeing the team of the dentist. So the dentist was not approachable or was too busy. And I encourage this patient to ask, and I think that's great. That's to have the dental team engage as well with the patient and educate the patient and listen to their concern. But I think in this specific situation with this patient, the dentist to hear that uh, conversation and to get that concern directly from the patient, I think it's paramount to both the dentist who provide the service and for the patient to have a solution. So don't hesitate to ask to speak with the dentist. And I think it's okay to start that conversation with the dental team, but it needs to be completed directly with the dentist who provide the service or the prosthesis in this situation. So, okay, so the subject of today was about dental implant because I'm most passionate about. Not to take away from how much important to keep your teeth healthy. So always make sure you visit your dentist, keep your smile on, and I will see you next week to your dentist talk. Thank you very much for listening. Post, share this video. I hope will be uh, uh, something that I can really improve the communication between patient and dental office. And always, I'm gonna be the one who to encourage you to see your dentist. See your dentist. Listen to your dentist, and ask many questions. This was your dentist talk, and see you next week. I hope you enjoy it.